My name is Joan Jonathan, a lecturer from Sokoine University of Agriculture, Tanzania. We have implemented a project for 2 years, from 2021 to 2023, and the funder of this project was the Sokoine University of Agriculture. One of the objectives of the project was to develop an integrated patient-centric tool that promotes adherence to treatment among people living with tuberculosis in Tanzania. Tuberculosis is one of the most killer diseases in Tanzania, and the WHO report of 2022 showed that a person infected with tuberculosis can be cured and prevented. The government of Tanzania has provided a good initiative of providing free treatment to people living with tuberculosis in Tanzania. However, there is a high rate of tuberculosis patients who are dropping from the treatment due to various reasons, including forgetting to attend clinics on the required appointment. On the other hand, the DOT nurse faces difficulty on identifying the TB patients who misses dose. Consequently, it is difficult to get a clear report on the number of patients who have dropped from TB treatment and led to challenges in decision making regarding tuberculosis management in Tanzania. Therefore, to solve this problem and improve treatment outcome of tuberculosis patients in Tanzania, we have developed an integrated digital patient tool that promotes adherence to treatment among people living with tuberculosis in Tanzania. This system is able to monitor the patients who are likely to drop or who have dropped from tuberculosis treatment in Tanzania. And it can send a message to a patient, reminding the patient on the required appointment for medication to the healthcare facility. The SMS can be sent to the patient phone 1 day before the clinic day. For example, a patient is supposed to attend clinic tomorrow. So today, a patient receives a written message reminding him or her on the appointment in the healthcare facility. Apart from that, in order to solve the challenge of poor reporting regarding the DOT nurse, this system is able to send a written message to the DOT nurse informing if there is a patient who missed the clinic. For example, a patient was supposed to attend the clinic yesterday. So the system is able to send a written message informing a DOT nurse that there is a particular patient who was supposed to attend the clinic and didn't show up. Through this, we expect a DOT nurse can make a follow-up to this particular patient through either calling or home visits, because the system is able to store all the details of the patient. The SmartTB system is copyrighted, and the owner of the intellectual property is the Sokoine University of Agriculture. This system has been tested by several healthcare professionals from 3 different hospitals in Tanzania, which are Mazimbu Hospital, Morogoro Regional Referral Hospital, and Sekoture Hospital in Mwanza. And the feedback was positive. And the healthcare workers are eager to see this system is utilized in Tanzania. However, the SmartTB system has not been launched, but it is ready for operation. Therefore, we call for organizations or funders who can work with us and collaborate with us so that we can take this useful SmartTB system to the community in order to reduce the transmission of tuberculosis in Tanzania and the eruption of new cases in Tanzania. Therefore, this system is very useful because it can reduce the number of TB patients who develop from TB drug resistance. Thank you.